Terence Higgins was one of the first known people to die in the UK of an AIDS-related illness. Today, the Terence Higgins Trust is a leading HIV and sexual health charity working to promote better sexual health, prevent the spread of HIV and support people living with HIV. Richard Angell is the Trust's Chief Executive.
Richard Angell from the Terence Higgins Trust. Welcome. Thank you so much for joining us.
Thank you for having me.
The Terence Higgins Trust has been around since 1982. How much have things changed with regards to HIV and AIDS since then?
Things have changed massively. When Terry Higgins was the first named person to die of an AIDS-related illness, there wasn't even a name for the virus that was making him unwell, let alone a test, any treatment or any care. And so much has changed in that period of time. We obviously had world-class testing. You can now get a finger prick or an oral swab test that will give you a result within 20 minutes. The treatment is world-class and means that if you're living with HIV and taking your medication, not only will that stop the onset of what we used to call AIDS, it will mean you become undetectable and unable to pass on the HIV virus to other people when you're having sex, even if you're not using a condom and they're not using PrEP. So we've seen a massive step forward. There's still no vaccine and there's still no cure. But because treatment is so effective, and it means the person living with HIV can no longer transmit the virus if they're taking their medication, and because we use some form of HIV medication for people who test negative in a thing called PrEP, which is a drug you can take that means you'll never get HIV, that plus condoms plus regular testing means we have all the tools necessary to end new cases by 2030. And if I had a time machine to go back and meet Terry and talk to him about that prospect, him filled with fear about a virus he didn't even know was impacting him, to where we are now in a place where we could be the first country in the world to end this epidemic. I think that's a remarkable change, an exciting thing to be part of at the stage we're at now.
I mean, you mentioned it there, one of your strategies is ending new transmissions by 2030, one of the government pledges. Is that really viable?
It's possible, but not yet probable. So we have all the tools available to do it. We have testing, we have condoms, we have PrEP, and we have treatment for people living with HIV. They're the tools that we need. And because we have the NHS, we have the ability to deploy those tools, but we're not deploying them all yet. So we have online testing, but it's not available all year round in all parts of the country. That clearly has to change. We've got a remarkable initiative in 81 A&Es, where if you go to that A&E and they take your bloods, they'll automatically test you for HIV, hepatitis B and hepatitis C. But we need that added when you do termination of pregnancy or having an abortion, when you're using contraceptive services, when you go to dermatology, all the things where you might be ill because of something of undiagnosed HIV or because you've had sex without a condom. So if we can situate tests and disrupt the patient pathway, we will find people that would never otherwise come forward for a test. Equally, that drug PrEP that I talked about, that you can take if you test negative to mean you'll never be positive, that's only available in sexual health clinics. But that doesn't work for lots of people. In rural communities, a sexual health clinic can be miles away, hours away potentially. If you're a black woman, you're much less likely to use a sexual health service, but will regularly use your local pharmacy. Why can't that be a drug that you can get an online prescription for and get more of your PrEP in a pharmacy setting? So we've got all those tools. We're not yet deploying them. We thankfully have a partner in government that shares our ambition, and they're rewriting the government's action plan to try and meet that ambition. And our job is to push them that bit further to make sure what is possible is what is real.
There are still an increasing number of people living in the UK with HIV. What are you guys doing to support them?
The support for people living with HIV is absolutely crucial, and the HIV Commission that concluded in 2020 found that only 40% of HIV clinics supported people with their mental health post-diagnosis. That's a travesty, really, and it's so important that we do, because HIV is no longer really about the medication, it's about the stigma that comes with it, the fear of how other people in your lives are going to treat you or mistreat you. And we've seen some really poor examples of people in healthcare settings and how they're treated. So we've got programs across the board, whether it's counselling, whether it's peer support, whether it's a newly diagnosed course, to help people come to terms with that diagnosis. And for those in their lives, maybe their parents or their partners or their children, to know about their diagnosis and come to terms with it too. But we're also trying to make the system up its game and make sure it is putting the support in place for those people living with HIV, and particularly those who are having the worst outcomes, those that are poor, those with childcare responsibilities, those that might be misusing drugs or alcohol. They need additional support in place, and we're working with Amanda Pritchard at NHS England and her team to try and improve that support for people living with HIV.
I mean, you've touched on it there, that we have obviously now got a new government. What are you expecting from them?
So I think Wes Streeting is the most versed health secretary in the HIV issue. He was on our HIV commission before he was even on the front bench. So he knows these issues well, and it was he that wrote the blueprint for his predecessors on how we get to zero. So he is more knowledgeable than before, and his deputy on this issue, Andrew Gwynn, has shadowed this brief for so much time and shown real personal commitment to it. So we've already seen in the last few months some real steps forward. Keir Starmer promised within 100 days they would announce a new action plan and start the process of doing it. They've already done that. I think it was 88 days. That was a really good thing. We've seen them agree to Mpox vaccines so that if Mpox comes back and if people are fearing it won't knock over our sexual health system again, and people can routinely now get their Mpox vaccines. That has really helped the system, and that will bring lots of people forward to get tested and to start PrEP as well as get their Mpox vaccination. We're seeing the first World AIDS Day reception in Downing Street since 2009, and I'm hoping that's an opportunity for Keir Starmer not just to talk about how he feels about HIV, but the things the government are doing and how they're moving this agenda forward. We've seen them recently announce that the HIV Prevention England programme will be extended for another couple of years. So we're seeing progress already, and they're only in their first 6 months. We've got a lot that we want to do, and in the run-up to World AIDS Day, we'll be outlining the series of things that we believe need to happen to get to zero, and we're hoping that that event at Downing Street will be a crescendo for some of our asks and the demonstration that they're listening.
I mean, the Trust has been around longer than World AIDS Day, but how important has World AIDS Day become?
World AIDS Day is a beautiful and important symbol. Firstly, it's about remembering people like Terry and those we've lost to AIDS and HIV over the years. We wear a ribbon to remember those people. But the day is about more than a ribbon. It's about that remembrance and saying thank you to those who cared for them. It's about reaffirming our resolve to get to zero. And it's also about supporting the HIV organisations that are out there, because we can't work on those social determinants of health for people living with HIV without people's money, resource and support. And World AIDS Day is often a focal point for all of those things, remembering, refocusing and remunerating our charities to make sure they can do this important work.
Richard Angell from Terence Higgins Trust, thank you very much for joining us.
Thank you.